This is Our Side of Addiction, the podcast. I'm Amanda Bork. Let's go. Come closer, turn me up. We are about to get into it. We are going to be talking about addiction as a disease. There are two models or schools of thought as it pertains to addiction. It sometimes can be warm or a little bit hot of a discussion. Is addiction a disease or is it behavioral? On this episode, we are going to focus strictly on the disease aspect or thought. And then in the next episode, we are going to do addiction as behavior. Sometimes we can fall in between or a mixture of two, but we'll leave that up to you to decide where you are on that matter. It's important for us, the loved ones of addicts, to understand more about addiction so that we are more versed in the subject and we can actually be supportive in productive manners. Because if we don't know much about addiction, then our responses to it, our thoughts around it, our expectations of it are not going to be accurately aligned at all. This was one of my biggest regrets when my sister was alive and in her active addiction. My sister Jenna, I didn't really take the time to learn about addiction. I never knew anyone. I knew an alcoholic growing up, but to actually have a grasp of what addiction was, I didn't. And I also didn't seek out that knowledge. Most of me thought that this was her problem and something for her to figure out and explore and manage on her end. It didn't seem to me like I wanted to because it was not my problem and I didn't want to make it my problem. That thought process, I can look at it now and realize how off I was. If I had learned about addiction, I think my responses would have been a lot different. I would have handled things differently, and I would have kind of gone after different types of support. That being said, my mistake is not going to be your mistake. We're out here being versed on addiction. Particularly, I bring things that are relevant to you, to us. I'm not bringing you topics that are beyond your scope or aren't going to benefit you at all. I only bring topics that you will find enriching and beneficial. This also helps us resolve some of our issues on our side. Thinking that your love is enough to make them stop. You begging and pleading is enough to make them stop. You thinking you can rationalize with them. You thinking enabling is the corrective action. You thinking there's nothing wrong with codependent relationships or dynamics. You thinking that once the addict is in rehab, it's all over, it's done. We can go back to normal life. You thinking a relapse is devastating and shouldn't happen. You thinking that the environment doesn't matter and our addicts can go right back into that same dysfunctional environment once they're done with rehab because the addiction disappears in that pretty little building over there. A lot of our brokenness comes from this misunderstanding of addiction. So that we set the ground rules here, addiction is a compulsion. It's defined as chronic and a relapsing, listen to that word, relapsing disorder that's characterized by this compulsive drug seeking, or if the addiction is behavioral, behavior seeking activities. Excuse me. Irrelevant of consequences. That means even if our addicts are experiencing consequence, it's not always enough to sway them. And I think we can get frustrated with that because we can see they're destroying their lives. The building is crashing down. Why is that not enough for you to change or want something different? It can be frustrating for us to understand, but that is what defines addiction, is this inability to stop or to even make decisions in a rational way. And these are changes that occur in the brain which drive that. It is seen as a brain disorder because it involves functional changes within the brain, how the brain functions, how the brain communicates to different regions, how the brain is rewarding, how it responds to stress, its level of self-control. Even if they might want to stop, their body is driving them to continue. Their body is literally telling them, go seek out drugs or go seek out that behavior and then I'll reward you. Who doesn't want a reward? You can't see me, but both my hands are up. Okay. I want a reward. And their brain is constantly giving them that and making them feel satisfied and gratified every time they seek out those behaviors. This doesn't mean it's impossible to stop. We know we can stop. We know we do have power over ourselves. Anytime an addict can walk through the doors of a rehab and recover. But getting them through those doors, everything in their body is trying to stop that. So it's this battle of self. That's why it's so difficult for them and so frustrating for us. They do feel deep amounts of shame around their behaviors. I facilitated meetings at a rehab for over 2 years. The subject came up of when people go on a little bit of a binge or a bender. And one person in the group said that he would disappear for weeks at a time and his family would constantly call his phone. They were worried, probably trying to see if he was alive. He said it was so annoying. They just kept calling my phone every 5 minutes, messaging me, voicemails. And I asked him, why didn't you answer? Why didn't you just message them? I'm alive. I need space. Something. Just at least something to them. In a text, you don't even have to talk to anyone. And his response was, I felt immense amount of shame and guilt. I know I'm a screw up. I'm an absolute fuck up, really is what he said. And I don't want to face that. It just feels dirty and ugly. For me, because I've been on the other side of that phone call, obsessively trying to get in touch with Jenna, and it's infuriating when they don't respond to you. I understand how gut-wrenching that was for his family. And while I understand that side, I, in that moment, was able to see his side. Because if you feel like the worst person on earth, you feel like a letdown, you feel like this is the 30th, 50th time I've relapsed and let them down, you're not really going to want to face it. And it seems easier to run away. And then when you're high, you're not feeling that guilt and shame. You get this reprieve, which also is BS, because while they're over there high, not in their feelings, us family is in the back, sick to our stomachs, not sleeping, worried every minute of every day. We get no reprieve. It's difficult, but it's one of the biggest things that I learned running the meetings at the rehab was just how much guilt and shame they carry with themselves. Even if an individual will go through the program, graduate, and kind of relapse very quickly within a few months, maybe come right back into the program, they'll sit all the way in the back of the room, head down. They won't make eye contact. They're ashamed. And they also don't want to be there. They have feelings and they know they're wrong. When we say addiction is a disease, it might feel as though, well, there's nothing I can do about that, is it? It is what it is. With addiction, we call it a disease because it's real, it's measurable, and the changes in the brain are things that we can calculate. You can even Google this, brain scans of addicts, and it will show you someone who's like a control scan, a person who's never used substance, or let's use cocaine, for example. A person who's never used cocaine versus a person actively on cocaine versus a person 90 days sober from cocaine. It'll show you how different the brain is. It's quite interesting. These changes include their self-control, their motivation, what's motivating them, to what extent, their stress, their pleasure as well. That's a huge one for people who are sober. Those first 2 years. It takes about 2 years for the brain to return to normal function once we've gotten sober. And the biggest thing I hear is people saying, I'm bored. Nothing is pleasurable. Life is so boring when you're sober. It's lame. That's what they say. It's so lame. I've even had people go through the program where at the rehab, they'll say, wow, I don't want to do meth, but I'm going to do mushrooms. For them, they can't imagine life sober because for them it's so boring. That's only because of the way the brain is functioning, and it hasn't returned to any kind of relatively normal baseline. It hasn't returned full function. So their levels of pleasure are not going to be things that you and I would find pleasurable. We can think of them as those thrill seekers, those extremists who are jumping off cliffs on the weekend, or rock climbing without any safety gear. Like, these people are nuts. The guy who was like, yeah, I jump out of planes on a Thursday night. You're like, what the hell? They're living extreme lifestyles, and that's reflected in them biologically. For them, going to a farmer's market, stroll on the beach, going to a museum, having dinner with a friend, those activities are wretched and boring and lame just because they haven't gotten their levels back normally. And that is a battle for them in sobriety, where they're trying, but everything kind of sucks and they are not feeling that pleasure. And we all want to feel that in some context. And that can sometimes drive them to a relapse. I try to tell them, we need at least 2 years for the brain. Most of them aren't going to make it to 2 years. So they keep resetting that clock. They never get there. They never get to see what's beyond the point when my brain is calmed down and it's functioning better. That's another thing for us to keep in mind. They aren't experiencing joy the way we do. Through addiction, the brain is prioritizing the substance. That's survival for the brain. And it's becomes this point where it's no longer a choice. It's about sustaining life when we've gone into the realm of being addicted. And topping that off is withdrawal. That's another driving factor. They don't want to feel those symptoms, so it encourages even more to continue that usage. And like I said, consequence is not always going to be enough. Consequence is one of the biggest driving factors for change. We have to get sick of ourselves and our lives and our outcome to change anything. However, they're going to take it to the edge. That's the saying, they have to hit rock bottom. Everyone's rock bottom is different. They really take it to the very edge where they have nothing left. Like riding till the wheels fall off type of vibe. And then they'll maybe, hopefully, fingers crossed, get into treatment. That's why for us, we might think, geez, going to jail wasn't enough. Losing custody of your kids, losing your job, like that's not enough. No, they're going to take it all the way as far as they possibly can. They'll live on the streets and be homeless for years and years. And they'll sustain that. And for us, we think, gosh, why do they keep doing this? Don't they see what they're doing? Don't they understand? The house is on fire. Hello, get out. You see the flames. You're smelling the smoke. You feel the heat on your skin. Get out. And they're sitting there, staying, watching that fire edge closer and closer. For us, we don't get it. It's crazy. Literally, you'll look at an addict and think, you are insane. I don't understand. It's that disease aspect of addiction that's driving them to be like this. And for us, usually, what we see is our loved ones, when they're in addiction, they're very different from who we used to know. That's because they've been overtaken by addiction and assume the identity of an addict, which has a profile. They're all basically going to behave the same, think the same, use similar strategies. It's that identity is very distinguished. Essentially, they've been hijacked, including their decision-making capabilities. They're going to seek out the risk for that. Those reasons we've just been talking about. They're getting rewards for it. They're avoiding sickness for it. Other reasons we categorize addiction as a disease, yes, there are changes that are occurring in their brain, their chemistry, with hormones that are driving factors. Also, like I mentioned, it's chronic. It's not just going to go away. It's basically lifelong. And I know that's a little hard to digest. And not every school of thought is going to align with that. But I believe it to be lifelong, in that we will see people with 30 years sobriety relapse, 30 years sober, 10 years sober, and relapse. It's pretty hard for me to think that, well, after 30 years, like, if it was not chronic, if it was going to go away, it should have gone away after 30 years. We want to think of addiction as lifelong, and they can stay sober as long as they're in maintenance. Kind of like, say we lose weight, we can keep that off as long as we are in maintenance. The second we start overeating again, guess what? We're going to gain the weight back. The second we stop eating, we're going to lose the weight. It's all about the maintenance of it and being vigilant. It's the same idea or premise with addiction. We can stay sober as long as we're maintaining it. The second we stop that maintenance, we go back. And it does involve these chronic cycles of relapse. That's part of the chronic aspect of it. That's why our addicts constantly relapse, and it's so frustrating for us because they're relapsing so much. I've seen people through the rehab that I had meetings at where they wouldn't even make it to a year and do that for a decade. Get to 9 months, relapse, 6 months, relapse, 11 and a half months, relapse, 11 and 3/4, relapse for a decade. It's chronic. They, as much as you hate it, they also hate it, because it's this constant cycle of having to restart, go right back over and do it all again. It's frustrating. And the chronic nature of addiction as a disease, like I said, it's not curable. It's maintainable, though. And the next reason why we might consider addiction a disease is that there are biological factors as well as environmental factors. Kind of like if you smoke, you might get a disease. That could be our environmental factor. Or say, for example, your family has a history of breast cancer. You might be biologically predisposed to breast cancer. So that could be the biological element. As far as biologically being predisposed, it's about 40%. And it gets a little bit complicated, but something to remember is that our environment tricks certain things on and off. Even if we're biologically predisposed to addiction, that doesn't mean we're going to be an addict. And I don't want you to believe anyone who says that either. They often will say that. I was born this way. I was always meant to be an addict. No. Even if you had biological markers for an addiction, the determining factor would have been the environment. If that surfaced, it was because the environment facilitated it or required it in some context. It's all about environment. That is going to be our number one factor. But we can't ignore the fact that there are biological indicators of addiction. And you can look that up. There are particular genes. I know I've seen ones for alcohol and ones for opioids, where the faster you metabolize alcohol, the more likely you are to prefer alcohol. You're going to drink more, and you could be more or higher risk of becoming an alcoholic just because of how quick your body processes it. And the reverse is true. There are some people who don't process alcohol very well or have adverse effects, kind of like, oh, I wish I could remember the gene. Let me Google it. Okay, here we are. It's called ALDH2. And this determines how we're processing alcohol. And there are gene variants that are very common in Asian countries, where you'll see that they don't process alcohol well. They'll commonly get that flush. I think they call it the Asian flush. When they drink, they'll get more nauseous than other people. They'll get more dizzy. They have more adverse effects to their body when they drink, which naturally is going to turn you off of drinking. And those are just variants that are occurring in the body, which can sway us in either direction. Kind of like redheads, where they need a ton of, anesthesia to put them under. It's just how they are biologically. And also the dentist, that numbing injection, they need way more to get numb. It's similar to that. So we can't ignore the biological factors, but I really don't want us leaning on that as the only thing, but we have to acknowledge it. And then another reason why we might consider addiction a disease is that there is treatment for it. We can go to therapy, there is medication, there are support systems, there are rehabs and programs. So because it's treatable, we can categorize it under the disease model. That's going to overlap with behavioral, because we can treat behavior as well, but that is one of the indicators of why it's disease. Something else for us to consider with addiction as a disease is that this is a big one, okay? Lean in. Addiction, we kind of think of it as the physical aspect of the disease that we can see. Them getting high, them gambling, them sleeping with prostitutes, whatever the preferred method is. Addiction actually festers in the mind long before you're going to see the behaviors. And that's why sometimes we can get thrown off kilter, because for us, we think you are doing amazing. You got out of rehab, you got a job, you got an apartment, everything was going good. What happened? Disease, this disease aspect of or thought of addiction, it's happening within the body before it's happening outside the body. Just kind of like any other disease you might think of. I know diabetes is used a lot in conjunction or as an example with addiction. It's happening within the body. You're not necessarily seeing the symptoms until it's unmanaged. Cancer happens inside the body before we're getting the symptoms physically. We can see that it's occurring. Addiction is the same. It's going to happen to them psychologically. They're going to experience things. And then we're going to see them through their actions. But that's after. And that's also why a person can be considered active addiction without using. A person can be in active addiction for decades. They just haven't moved through this cycle of addiction. They haven't moved to physically using. That's not to scare you or make you hyper paranoid and a pessimist, but that's to say that addiction is far beyond what you can see, far beyond someone getting high or gambling their life away. It's in the head first. What are some myths that we might have? Now that we understand a little bit more, what are some myths? If they loved me enough, they would stop. Oh, I hear this so much from the loved ones of addicts in my professional work of supporting them and guiding them through the process. So much. They just can't understand. It's like you're giving our relationship away. You're giving our love away. I don't matter enough because if I did, you would fix this. And I wish that was true, but I want to bring us back to what we were saying in the beginning about consequence. Them in that house that's burning. They're sitting beside the flames, hanging out, not moving. The skin might even start melting off and they still won't move out of there. They're going to ride it till the wheels fall off. They're going to take it to the edge of the edge before they change things. Usually, not always, because I know some people who can make corrective actions a lot swifter. But usually, most of the time, they're going to take it to the edge. It's got nothing to do with you or the kids or your love or whoever else is involved. It's not about you. And I think we naturally try to make it about us, but it's not. It's not about you, your relationship, your love, your feelings, your hopes, your fantasy about the future. It's not about you, babe. That hurts our feelings. It hurts to feel like someone we love turns away from us. They're treating us like dirt. They obviously don't care about us the way we care about them. Obviously. In addiction, they're really incapable of loving the way we see love and of having any kind of sustainable relationship that's healthy. They're not capable. There's just no space. That's the glory of addiction, is it's this entity that comes into our loved ones and consumes them completely. There's no extra space in there. I want us to stop making it about us and directing it around us, because it's not. And it's not about love. Our love is still there, even if we're going through this hardship. But it's not going to be a driving factor for change. It's just not. Another thought we might have during this is my fault. Particularly, we could see this in the parents of addicts. Because, what did I say? The determining factor of addiction is environment. And if that's true, what kind of environment did I create that caused my child to have an addiction? Look, that's a hard truth. That's tough to sit with and bring awareness around, for sure. And that might cause us to go into that guilt and shame cycle or loop. That's not what we're about here, though. I think it's important to bring awareness around what happened, how your perception of things could be different from them, what impact certain things had on them. Yes, for the sake of awareness and betterment, personal development for us, yes. Because we have to remember, we don't ever want our addicts, once they're in sobriety, we don't ever want them going into an environment that's dysfunctional. So if your environment is still in that state, whatever that means, you want to make sure your sober loved one is not going there. They're not invited there because it's not conducive with staying sober. I don't care how much you want them to live with you. It's not healthy for them. And we have to stop making it about us. We have to make choices in the best interest of them. So safeguarding them, or ultimately, the best case scenario is bettering this environment. Because you deserve a better environment as well. I don't want us to fault anything or anyone. Whatever happened is what happened. Having that awareness is also having that acceptance of it. It happened. I didn't know what I know now. I made mistakes. Some things happened I didn't anticipate or want. Whatever the case. We have to be able to move through that. The swifter you move through that, because I don't want you sitting in that disdain, the swifter we move through, the swifter we process and move on. That's the best way we can support our addicts, is swiftly processing and moving forward and becoming better versions of ourselves. I would never say it's anyone's fault, because we're all making choices. Even if they were children when they started using, it was definitely less of a choice, but it was still a choice. With my sister Jenna, she hung out with people who used heroin, shot up heroin when she was very young. I never had those kind of friends, ever. I actually had to force my friends to smoke weed with me. I was the troublemaker. We chose different friend groups for particular reasons. There is autonomy even if we're younger. We're not perfect. We don't love perfectly. We don't make perfect decisions. That's just how it is. We experience these extremes when we love an addict. And we try our best to survive, because we're also trying our best. Before the addiction, during, after, we're just people trying to figure it out. There's never any expectation of perfection as long as you're near me. We are F-ups, okay? I'm a F-up. Fine. And what? I'm trying my best every day. You don't get the best of the best every single day. Sorry, not the version you saw today. But doing what I can with what I got. That's it. And that's how we're going to prevent ourselves from going into those shame and blame loops. Yes, there's healing that needs to be done, conversations, because if some gritty, nasty things occurred, the very least we can do is have a conversation about that, if both people are open to it. Because I don't want to diminish anything or feel like you quickly moving on is enough for the other person. At the very least, they deserve a conversation. And they deserve a little space while they process what happened. They're not on your timeline. It's important that we give ourselves some grace. The reason we're giving ourselves some grace is because of the emotional toll this takes on us. It's immense. I always say this. It's bullshit having to love an addict, having to know someone with an addiction. It's utter bullshit. Because we are tormented and traumatized through that experience. There's a high amount of anxiety, depression, loss of identity, grief, emotional numbness, and all of this turns into chronic stress. Our brains change when it's under chronic stress. Just like an addict's brain changes during addiction, our brains are changing because we're under chronic stress. We're constantly on alert, trying to be hyper vigilant, trying to catch them high, catch them in a lie, skirt their manipulation tactics. We're trying to trust them, but we don't. We're trying not to think bad thoughts about them, but we do. We sacrifice ourselves. We're sometimes asked or demanded to sacrifice ourselves for them, which is crazy because they would never and are never put in that position for us. But here we are, the bold and the brave and the beautiful, being asked this of us. Our life literally shrinks for them. It becomes very small, pinholed, very dark as well, and confusing. It's an immense emotional toll on us. Giving ourselves a little bit of grace with that because we're under so much pressure and stress. And sometimes this can roll into resentment. And it's important that we aren't making this about us in the context of trying to be supportive of them, but also making it about us when we're separately going along our journey on our side. I always say this. We have a journey and we have a process. It's not linked to theirs. And sometimes we can attach ourselves to them because maybe we don't know better. Or we think that's the resolve to our problem is getting them into sobriety. Then our problem is over. It's not. It's very important that we understand the addict goes away to rehab to get help, but we also have to go to our own places to get help for our side. If we're dumping all our expectations onto our loved one, that's when we start misconstruing things. That's when we start thinking, isn't my love enough? Can't you just stop? If I can only get you into rehab, my life can go on. We start coming in with these very false expectations or thoughts. You suffer. Your suffering is there. But the suffering is separate from theirs. As far as addiction being a choice, that also gets to be a little bit of a warm to hot topic. I'm kind of on the fence about it. I get both sides, but I'm kind of torn where I couldn't make a full decision because the heart or the hardness of my heart goes more toward personal accountability, and you're responsible for yourself. Your choices are yours, and we can't blame that on anyone else. But then we can't ignore the fact that if someone grows up in a bad environment and went down the road of addiction, how much can we really fault them? At the rehab where I ran meetings, I had some people share some things that just tore me apart and took every ounce of me not to cry in front of a room full of people, because these stories are gut-wrenching, the things that have happened to them. And you kind of think, like, if I had that happen to me, you're damn right I'm going to use something to escape that. I don't want to feel that. I don't want to think about that. And to live with that, these stories are horrible. So I also think, if they're starting around 10, 12 years old, they're babies. They don't know. Completely innocent or completely a victim of their environment. 10, 12, you don't know anything. You're a product of whatever you were taught. But I am on the fence. I think too, Jenna used to use this excuse, and I swear I wanted to punch her right in the nose. I wanted to break her nose and see blood when she would say this to me. It was almost in a mocking kind of a way, very dismissive, but she would say, I can't help it. I have an addiction. I have a disease. I tell you, that hardness in my heart was like, F you, bitch. Don't worry. I called her a bitch when she was alive, and she's good with it now, too. Used to piss me off to no end because I'm not a victim mentality person at all. I'm the farthest thing from that. And I felt like she was playing a victim. And also because I grew up right next to her and didn't turn out like her. Pissed me off even more. I felt like it was an excuse. And if I'm looking at it now, yes, it was an excuse for her, for herself, and for everyone else to shut up and leave her alone. Stop talking about getting sober. I have a disease. I can't help it. Da-da-da. They do cherry pick that as a reason, and they will use that in negative context. But they're just using it and swaying it in their advantage side. Just because we have a disease doesn't mean there is not a remedy. If you have diabetes, there's some ways we can manage that, right? So you can also land on whatever side or straddle the middle too with me, and that is this in their control? Is it not? How much is a choice? How much is personal responsibility and accountability? But maybe trying to have a little bit of empathy. I didn't empathize very much with addicts until I ran the meetings at the rehab. I really didn't empathize at all. I was very angry at anyone who represented addiction. Any person I saw on the street, I had ill thoughts about them. Especially someone begging for money or something like that. I think it was also a representation of what happened with my sister, and I got very bitter after she died. I got very angry. But then my work at the rehab taught me to have compassion and empathize, and hearing their stories and hearing their pain and their difficulties, seeing them with their shame and their guilt as they relapse for the 5th time and they're back in my room. Being around that really gave that gift to me. So if we aren't able to have some kind of empathy or compassion toward it, maybe branch out a little bit. Can we read some books by some addicts or listen to some of the things that they have to say? I know, social media, podcasts, YouTube videos, what have you. Maybe you want to go volunteer somewhere or engage with addicts themselves in some capacity. But having empathy and compassion is not the same as giving them write-off excuses. We definitely don't want to do that. Because when we allow them to take accountability and responsibility, we're actually empowering them. We're giving them ownership of their lives and their decisions. And that's ultimately the best gift we can give someone, is just watching them own it and not punishing them at all for owning it, but allowing them to own it. Another thing we have to take into account is, of course, the trauma. Trauma is, it's very rare for me to come across an addict who doesn't have trauma. And even if they say they don't, they'll share a story and you're like, that's trauma, bro. Like, you're not admitting that. There was one person for example, I shared something I saw on the news with the group. It was a little boy who was 12 years old, I think. And his mom had a boyfriend and they just abandoned the boy. The boy went to school. I'm laughing because this is crazy. The boy went to school and came home and the apartment was empty. The mom moved out and they left the boy behind. Crazy. And I was telling that to the group, we do a little intro and get everybody settled and just have a little chat in the beginning. And someone in the group shared, because when I said that, everyone agreed that was horrific and crazy. And someone shared they had a very similar situation. And they said, I didn't really see it as traumatic. What? You were abandoned when you were like 13, 14 years old, and that wasn't traumatic? We can sometimes dismiss things just for the sake of survival. Our brain, it's a strategy. We can't really dwell on every single thing, or we might collapse, and our brain might not allow us to process things as they are for that reason. And he came back to me as like, I really been thinking about that. I guess that is trauma. I was like, yes, that's insane. Of course you don't feel loved. Of course relationships are hard. You don't trust people. Maybe you try to abandon them before they abandon you. Of course you're an alcoholic. Like, geez, bro, that's horrible. There is trauma out there, and when our addicts have this trauma, even if they're going to say they don't, there is probably something in there that can feed addiction. Along with that, mental health. Mental health is a huge factor in conjunction with addiction. Either it occurs before or it occurs as a result of the addiction. Sometimes, especially if it's a young kid, they have a mental health disorder, there's not support or conversations about that in the home. They figure out that substances are an escapism from that, or they might feel normal, or for the time that they're under the influence, they don't have these crazy thoughts or feelings. That's nice. So they learned to medicate that way. And also, as a result of the changes in the brain from addiction, it can cause mental health issues. And those are things that have to be addressed separately. Any kind of trauma, yes, we're going to explore trauma in rehab, but we're not always going to explore it fully. We kind of explore it to get you out there and going. Usually we need a little more time to process that. And also mental health issues have to be addressed separately because they can cause someone to relapse. We have to take those things into consideration. And because there's such variance, there's going to be variance in treatment. Some people, they can just abstain. I have met a few people who don't identify as an addict, and I can't say whether or not they are. They don't believe to be, and they realized they were getting out of hand, so now they abstain. Some people need the 12 steps or some kind of program. Some people need to go to a treatment facility or medication or therapy, whatever is happening. We have to give people or our addicts a little space to figure out their perfect combination and what aligns with them the best is going to give them the best results. And that feeds into why we're getting relapse sometimes, or the relapse rate is so high, is we're not going to hit it on the head the first time. We're really trying to figure things out and adjust and make corrections as we go. And one program is going to work amazing for one person, and the next person is not going to do good in that program at all. We have to be adaptive in that as the loved ones and not think, oh, relapse is the end of the world. It's a failure, didn't work, waste of money. But rather, how can we bounce back and adjust from this? Having more of a pliable approach is very important for us. We're also not going to get our hopes dashed as much or feel that heartbreak so intensely if we're being malleable. What exactly does this mean for you, for us, the loved ones? Understanding, having this better grasp of addiction does not mean we're tolerating behaviors, accepting abuse or chaos or harm. No. We're also not excusing things. Or maybe is that what I just said? Anyways, like Jenna. Oh, I have a disease. We're not doing that. We're also not accepting that. Pop you in the nose. No. It's having this understanding of where it comes from, how it occurs, what it looks like, and why it's so difficult for them to stop. Because it's not a matter of just stop, just go to rehab. It's not enough. If we need to lose weight, what do people say? Just go on a diet, just move more. Yeah, I know that's what you got to do, but getting there, doing it, it's different, isn't it? How many diets have you gone on? How many times have you been like, fuck it, I'm eating this cake, restart on Monday? A lot. And that, well, as long as we have a relatively normal relationship with food, that struggle is nothing in comparison to addiction. Keeping that in mind, we can understand all of this about addiction and still implement our boundaries, still process and go on our journey separate from them, still set our guidelines and rules with them and not put up with any nonsense from them. And we can be more supportive of them. We can protect ourselves physically, emotionally, mentally, while being supportive of an addict, being understanding of them, caring for ourselves in the ways that we need to, stepping back if we need to, saying no, prioritizing our health, and still be supportive of an addict, still empathize and have compassion for them. Going through this, we want to make sure that we don't set ourselves up. Partly that's why I advocate for addiction awareness and understanding for the loved ones of addicts, because we know it's not a straight line, it's not a straight shot. There's going to be setbacks, restarts, all of that messiness. We want to make sure we're not setting ourselves up for disaster or heartbreak. And just because there is a relapse, it doesn't mean that our addicts aren't going to recover or that it's impossible. It also doesn't mean that we have to endure the endlessness of the cycles. We have to understand that addiction is not something for us to fix. It's not for us to manage. But instead, we can learn about addiction, learn about treatment, expand and grow as a person individually, elevate ourselves. We can get the support that we need, setting our boundaries, caring for ourselves, highlighting what we're willing and unwilling to do. That's what we can do. Can't fix addiction, but we can do all these other things. It's not just an addict has bad behavior and they chose something bad. We can't ignore the fact that it's disease-based, it's biological, it's environmental, it's about pain, it's about trauma, it's about awful experiences. And loving them is horrific. Watching that, standing beside that is awful. Having that compassion, yes, for them, but also for us. We need that for us. And I think we can have more compassion for ourselves the more we understand addiction. We lessen our burden of loving them. And in doing so, gotcha. Gotcha. That's all that I got for you today. Happy to have you here. I always love spending time with you. And, where do you fall on the fence? Disease, not a disease. I don't know yet. Still trying to make up my mind. I look forward to spending some time with you next week. And we will see you there. Alligator out.